But let's also make sure we think again of some of the barriers to patients. And on the right-hand side is that graphic looking at some of the classic excuses that we've heard from all of our patients. But let's also be realistic here, and that is that your patients don't do their exercises. And I do appreciate that this top study published back in 1973 is probably a little bit dated, but it showed at that time, at least, that exercise adherence by patients was only about 30%. So only 30% of your patients actually did their exercises they were given. Why is that? Well, I think one of the reasons is we give people too much. And to support that statement, there's a randomized controlled trial study here done by Henry, showed that if you give patients either 2, 5, or 8 exercises to do at home, the compliance was actually the best for the patients who were only given 2 exercise compared to those given 8. And why is that? Well, again, I think the patients feel overwhelmed. They don't know where to start. So I think the maxim of less can be more is a good one to start with and build on the patient. And my perspective is the patient gets to earn their next exercise when they've done the ones that they've already done successfully and that's ready to be moved on. Let's also consider some of the patient preferences here. What do patients like? And a really good resource here comes out of Otago University in New Zealand, and there's the link out to this, looking at patients' preferences for hip and knee arthritis. This is a really good site, and you can basically use it to with your patients to look at what their preferences are going to be in order to help them to be more adherent to home program and programming in the community.